I deeply thank each and every one of those. We've seen records broken every day, and that is no exception. Regrettably, to 8 p.m. last night, we had 136 cases of local transmission, and unfortunately, 53 of those cases were infectious in the community. There is no doubt that the numbers are not going in the direction we were hoping they would at this stage, and it's fairly apparent that we won't be close to zero come next Friday. The crisis cabinet meeting of the New South Wales government met this morning from 8 o'clock, where Dr. Chant and her team advised us that the situation that exists now in New South Wales, namely around southwestern and now western Sydney suburbs, is regarded as a national emergency. And for that purpose and for that reason, the New South Wales government will be taking action in relation to that. First and foremost, the local government areas of both Cumberland and Blacktown local government areas will also be subject to workers not being allowed to leave those communities unless they're health and emergency workers or on the authorised list of workers. So unless people are critical workers from the Blacktown local government area and the Cumberland local government area, we don't want any workers leaving that area unless they're regarded as critical workers. The list for what is critical, obviously, or authorised already exists. So we do ask citizens to look at those lists to make sure they don't leave their local government area, which is defined by the suburbs in which they live, unless they work in health, aged care, or are on that authorised list which already exists. Now, can I stress how deeply grateful we are that most of the work that's carried out to keep all of us fed, all of us well and healthy, comes from the southwest and western Sydney suburbs. And we have to acknowledge that and thank all the citizens there. But we also have to acknowledge that we need to contain the spread of the virus. And that is critical at this time, which is why the New South Wales government has, based on Dr. Chant's advice this morning, taken these additional measures. Now, can I stress deeply that we really want everybody to follow these orders to make sure, as I said, that we contain the virus within these local government areas. I also want to stress that from today, the New South Wales government will be calling on the federal government to refocus our national vaccination strategy. There is no doubt that if we want to contain this virus and stop it seeping out to other parts of Greater Sydney, stop it impacting our freedom and our economy, but also stop it spreading into other states, we need to have a discussion about refocusing the national vaccination strategy. Now, what we've done as a government is refocus our efforts in distributing vaccines in southwest Sydney. We have a micro plan for how we will get not only more doses of AstraZeneca in arms, but we also have to acknowledge that that is a very young population in those communities, and we need at least more first doses of Pfizer. So we will be taking to National Cabinet, through the advice of the Chief Medical Officer, our strong advice and recommendation that consideration be given to at least having more people have at least one dose of either vaccine, which reduces transmission. Fortunately, one thing that's become apparent during the last few weeks is that barely anybody with 2 doses of the vaccine is having acquired serious illness. The vaccines are working. That is excellent news. We know the vaccines work in stopping high rates of transmission, which means stopping people spreading it as much as they otherwise would, or stopping people from getting very sick. Now, that has been a green shoot, that the vaccines we have, both vaccines, are working. But we need to get more of them into arms, even if it's the first jab, because we know that reduces transmission, or it protects someone up to 30%. And that is really important, because at the moment, any worker, and again, we know the virus is spreading through workplaces and also through households. And when we're talking workplaces, we're talking things that are necessary. People who work in those critical food outlets, critical distribution chains, unfortunately are acquiring it or getting the virus and taking it home, and then everybody in their family is having it. And clearly, if you have multi-generations in the one household, that has a different impact. But I just want to say to the people of southwestern Sydney and western Sydney that are now most impacted, that not only will the government provide you with additional support, but we'll also be considering over the weekend and early next week measures to provide you support in different ways given the complex nature of communities, and also making sure that we target those initiatives properly. I also want to stress that, that the New South Wales Government, based on the advice of Dr Chant, will be working hard over the weekend and early next week to provide a roadmap for the people of New South Wales. Our challenge is, as I said yesterday, to live as freely and as safely as possible until we get enough vaccines in arms. So that means that we need to live as freely and as safely as possible during August, September and October. According to the federal vaccination rollout, by the end of October, we will be at a stage where much more of our population will be vaccinated, and we'll be able to live much more freely beyond that point. But we have to provide a roadmap to our citizens as how best we can live freely, but also as openly as possible. Now, the New South Wales Government will be refocusing our efforts to a much more targeted strategy around those local government areas that are most impacted, because we want to contain the spread. But this doesn't mean, as Dr Chant says to us all the time, and to me personally, this doesn't mean that if you live outside those local government areas, you don't have to be on high alert, because this virus is spreading everywhere. We've seen now sewerage in northern suburbs and elsewhere, where again, through workplaces, people are unfortunately either getting the virus or spreading the virus and then taking it home. So just because you don't live in those 5 local government areas we've been focusing on doesn't mean you can't get the virus or spread the virus. But our focus remains containing it within those areas, but also reducing transmission in those areas and allowing people in those communities to live as safely and as freely as possible. And I can't stress enough that we will be redoubling our efforts to think innovatively and outside the box as to how we can get direct support to people on the ground in those communities. But I just want to stress, and I'll use the words Dr Chant used with us only this morning, that she regards what is happening now in New South Wales as a national emergency, and our government will be responding accordingly. But please also know that where there are opportunities for us to open up, to ease restrictions, to let the economy undertake its necessary work, we will do that. But we will have a clearer view next week on what August, September and October look like for our citizens around the state. And our strategy remains to keep the virus obviously out of the regions and allow the regions to continue doing what they're doing. But our strategy also involves having a much more targeted and localised approach, as well as looking at other parts of Greater Metropolitan Sydney and what adjustments need to be there. But there is no doubt that we believe very strongly that we need to refocus the national strategy on vaccine rollout, given the situation New South Wales is in. We need to administer at least the first dose of any vaccine into arms as much as possible. And we also need to acknowledge that the population of South West and Western Sydney is younger than the average population, and we need to consider that as well. And I will be raising these issues at National Cabinet, as Dr Chant will with her counterparts. Dr Chant will now give her health update and then we'll take questions. And I also want to say that tragically, as we see more cases develop, we will also see more hospitalisations and more people in intensive care. And regrettably, we did have an additional death overnight, which I've only just learned about. And we'll provide more information during the day once we're confident that family members have been advised. But